In this lesson, we'll be looking at systems of classification for mental health. Specifically, we'll be looking at the categorical and dimensional approaches, so using categories and using dimensions in order to diagnose and classify mental health and mental illnesses. In this lesson, you will be able to explain different approaches to diagnosing mental disorders in psychology, outline the advantages and limitations of the categorical approach, which is the one we will be focusing on in this video, and then outlining the assumptions that underlie this categorical approach. When you're looking at the difference between the categorical and the dimensional approach, this example that we're about to go through outlines some key questions that you should be thinking about. So if you take a look at page 483 of your textbook, figure 12.12 outlines this example. For categorical approaches, it's all about categories. So is the person in this category or that category? Questions that have a yes or no answer will be able to help you to put patients into different categories. So, for example, a patient might be asked, does this person have high blood pressure? Either yes or no. If it's a yes, then they're in one category. If they're no, then they're in the other category. On the other hand, dimensional approaches looks at where does someone fall along a continuum. So it assumes that everyone is along the same continuum, and they're asking questions that will help them to understand where does this person fall on the continuum as opposed to black and white, yes and no. So a question that might be asked in the dimensional approach might be something like, where does the person's blood pressure fall on the continuum of measurement? What I want you to think about is what is one advantage and limitation for these different types of classification, and we will be discussing the answers to this later on. Categorical approaches organize and describes mental conditions and disorders in terms of different categories and subcategories. So when they're looking at mental illnesses, there are broad categories that people will either fit into or not fit into, and then subcategories within those ones. Each of these categories have specific symptoms and are typical of specific mental conditions and disorders. The two key types of categorical approaches we'll be looking at in psychology are called the DSM and the ICD, and we'll look at these two in a little bit more detail in the coming slides. There are also some key assumptions that have to be met for categorical approaches to be used in order to classify mental health and mental disorder. Firstly, it assumes that mental disorders can be diagnosed from symptoms presented. This also implies that thoughts, feelings, and behaviours can be organised into categories, and that there are clear boundaries for each disorders, and that disorders don't overlap. Now, we know that this doesn't actually always happen in reality and in practice. However, these are the underlying assumptions when we're looking at the DSM and the ICD. It's basically an all or nothing principle, so you're either in or not. You either have that symptom or you don't, and you're either in that category or you're not. It also assumes that this system of categorical approaches, so it assumes the DSM or the ICD, these systems are actually valid and reliable, therefore we are using them. In psychology, the main categorical approach that is used is based on the DSM-IVTR. Now this stands for the Diagnostic and Statistical Manual of Mental Disorders, which is shortened to DSM. IV is number 4 and TR means twice revised. The newest edition is actually the DSM-5, which came out earlier this year, but for the sake of this study, we'll be looking at the DSM-4. So the DSM-4 twice revised classifies 365 different mental disorders. These are grouped then into 16 major categories and another category called other conditions. If you take a look at box 12.4 on page 486 and 487, this looks at all of the different categories that are outlined in the DSM with a description of what each of these categories refer to. For example, there are some such as anxiety disorders, somatoform disorders, dissociative disorders, eating disorders, or sleeping disorders. In class, we'll be taking a look at different mental disorders and which one you would think they are best grouped into each of these categories. So the DSM provides information on the typical course of the disorder, that is how it will progress, the early symptoms that you see, and then how it is likely to develop. It will also indicate the degree of impairment, the prevalence, so how often does this disorder come up in different populations, whether the disorder is likely to affect others in the family, so if it has a genetic component, and the relationship of the disorder to gender, age, and culture. They also have something called an inclusion and exclusion criteria. So an inclusion criteria are symptoms that the patient needs to exhibit in order to be classified into that specific category, and if they have one of the exclusion criteria, then they don't fit into that category. The DSM is also based on 5 different axes, and these axes have different information about the person and their mental condition, and it's other things to take into account when you're diagnosing. So axis number 1 looks at clinical disorders and other conditions that may be a focus of clinical attention. Axis number 2 is personality disorders and mental retardation. In this case, it means the slowing down of. In axis number 3, it is general medical conditions. Axis 4, psychosocial and environmental problems. And axis 5, global assessment of functioning. We're going to have a closer look at what each of these axes mean in class, and for you to deconstruct them to understand them in more detail.